So now we'll move on to the next talk. So my name's Gary Hsich. I'm one of the pediatric neurologists at the Cleveland Clinic. And so I see a lot of the patients with neurofibromatosis. And I'm going to talk about school learning and ADHD challenges. So this is a topic that's very near and dear to my heart. My daughter is a first grade teacher, and if I had not become a doctor, I might have thought about becoming a teacher. So, the things that the key points that I want to talk about today here, that school learning and behavior problems are very common in children with neurofibromatosis with NF1. There may be other important underlying factors contributing to their learning and behavior problems, especially anxiety and immaturity. I'm going to talk about some various strategies that we can use to help manage these learning and behavior problems. And also, I want to emphasize that there may not be an easy medication or medical solution to these learning and behavior problems because they are so complex. And so I want to talk about that and review that. So with neurofibromatosis, it's very common that a lot of patients with neurofibromatosis have learning problems. Now, not to be mistaken in that it's possible that many of our neurofibromatosis patients can have normal or above average intelligence, but at least half or maybe 3/4 of the children with NF1 do have learning problems. And it is well known and documented and published that the average IQ of children with NF1 is about 1 standard deviation lower than individuals in the general population. So it is a common problem that we do deal with. The percentage of patients with intellectual disability with neurofibromatosis is roughly in the 4, 8 to 10% range. The general population, it's about 2%. So that's people with an IQ, which is 2 standard deviations below the mean, so an IQ of 70 or below. And somewhat related to that, a lot of our patients with neurofibromatosis have behavior issues that anywhere from, roughly about half, depending on what study you look at, 1/3 to 2/3 of patients have behavior issues. And so as a pediatric neurologist, what I end up doing is, I'll see patients as soon as they come in early, starting at infancy even or early childhood. And I'm looking at their development, and the reason the development's important is because a lot of times it's the first sign of a future learning problems. So normal development in babies, their first words at around a year of age, maybe they start saying sentences or putting 2 words together at around 2 years of age. In between there, between 1 to 2, they start understanding and learning a lot of verbal language. And also there is a wide range of normal. So that's a big consideration for us in assessing children with neurofibromatosis and potential learning disabilities. Now, once they get to school, in preschool, they're sometimes that early on, there are identified learning problems, and sometimes we do send children specifically to preschool through the county because they have risk factors or are identified to have developmental delay in learning problems. Kindergarten is always this kind of adjustment issue. It's a first year of school for most kids. They're learning to get used to the school environment and being in a classroom and listening to the teacher and paying attention. And so it's hard to tell for sure whether they have learning issues sometimes in kindergarten. Early elementary school, then we're starting to really pick up. They got to start reading and writing and adding and subtracting. And that's when mild learning issues become more apparent if things haven't been noticed already. Middle school, there are a whole host of issues that come up there. There are peer issues, there's puberty and hormones, increased behavior issues in middle school. So, and that affects learning. And then in high school, we're trying to prepare our children for real life, for adult responsibilities, maybe potentially for college or life skills. So there's different things we're looking at all through that school environment. And one of the things I do talk about is how to keep students engaged in school. And especially for the students who have learning disabilities or are struggling in school, that they don't hate school and that they continue to like going to school and love it. Because if they hate school, then that's even another challenge that comes up. And sometimes that does happen. Kids are struggling in school, they can get into trouble. So then everything about school becomes negative for them and trying to keep them engaged. I don't get so involved so much into the labels. There are labels out there: dyslexia, executive functioning problems, apraxia, auditory processing deficits. And one of the things I kind of find with those labels is sometimes it doesn't really help me figure out what's the best plan of action for them. Despite those labels, we don't necessarily have a specific cause of some of these problems, and we don't necessarily have a specific therapy or treatment or learning program if they have dyslexia versus executive function versus apraxia. And so a lot of times it's the individual assessment that we have to do. But I do want to talk a little bit about attention deficit and ADHD also. But more I like to talk about kind of what the specific problems are, what their academic skills are. Maybe they're 10 years old, but what age level skills they are. They're 10 years old, maybe they're in 5th grade, but are they at age and grade level, or are they a year or two behind, or how far behind they are? When they're reading, what's their fluency like? Maybe they're fluent in reading, but they have problems with comprehension. With math skills, what is it that they have problems specifically with addition or subtraction? You can see a lot when I lay things out there and I have them do a subtraction problem where they have to borrow and carry, and long division, all those multiple steps there, or with math word problems where they got to read something and then understand what they're reading and then translate what they're reading into an equation and then solve that equation, double check their work. There are a lot of steps there. And as I see kids kind of do that, I kind of get a better idea of exactly what their problems are. And so, it's those kind of granular, finer points that sometimes we fail to look at and need to understand better. And I think that's one of the problems when we talk about, attention deficit and ADHD. A lot of times I see that, if a kid has a school or learning problem, there's kind of a knee-jerk ADHD, throw them on a stimulant medicine. And, I kind of have this personal thing that I want to really change how we think about or assess kids with potential attention deficit or ADHD. Some of the problems with that label, it's very controversial in terms of how to diagnose it. There's no easy or accurate diagnostic test. It's very subjective in terms of some of the criteria relies on behavior of opinions and interpretation of behavior. There are many differences of clinical opinion, and there's some evolving criteria over time with it. Several years ago when the DSM-5 came out, they changed the criteria that if you're 17 or older, you only needed 5 out of the 9 symptoms in this checklist. If you they changed the age of onset. Before, your symptoms had to be present before 7 years old. Now, before 12 years old. So there's a lot of kind of differences or changes. And just as an example, I kind of wanted to run through some of these things that, in our criteria. There are about 9 things, a checklist of 9 things that people talk about for inattentive, quote unquote, ADHD. And so things like fails to give close attention to details or make careless mistakes in schoolwork or other activities, difficulty in sustaining attention to tasks or activities, often does not seem to listen to when spoken to directly. As I go through this, I'm sure a lot of you out there, you may be saying, hey, that's me, that's me. I'm like that. My child's like that. My spouse, my partner's like that. Often does not follow through on instructions, fails to finish kind of work or chores, difficulty in organizing tasks and activities, often avoids or is reluctant to engage in tasks that require sustained mental effort. Often loses things like your pencils, your wallet, your glasses, your cell phone, often easily distracted by extraneous stimuli, often forgetful in daily activities, running errands, returning phone calls, paying bills, doing homework and things like that. And when I look at this list of things, I kind of feel like that's almost all of us, at some point, at various points in our life or kind of every day, because we're so busy, we're so distracted, we got so many things going on. I mean, kind of probably right now at home, you're probably trying to make meals, you're probably trying to remember what you got to do for the day, you're probably trying to keep your kids from fighting, kind of all kinds of stuff going on. And if you have a sick child, if you have a sick parent, you have job stress, all that's going to affect and it's going to give you these symptoms and kind of make you less attentive. And so one of the things that I would say, in this ADHD criteria, in the small print that a lot of times we sometimes forget or ignore is must not be better explained by other things going on, such as depression, anxiety. And I would say there's other, just like I talked about these other things. And so how good are we identifying or exploring, discussing about stress and mood issues? So what causes inattention? And inattention is a very nonspecific symptom that can be caused by anything that affects cognition. So I already talked about medical disorders, fatigue, poor sleep. Poor sleep is a big one, especially for our teenagers. They're up late at night on their cell phones, social media, doing things on the computer, maybe doing homework. Immaturity is another one. And so there are many, many different things that can cause inattention that lead to this term ADHD, but, does a stimulant medicine really fix those problems? Is that really going to take care of it? And so, so these are the things I like to, talk about or consider, medical problems like neurofibromatosis. Are you getting enough sleep? Is there an intellectual learning disability? Do you need an extra help and more repetition and more time? Immaturity, I think, is a big thing, like a lot of times that we don't talk about medically. Partly because we don't have a treatment for immaturity. We can't make people more mature with a medication. But a lot of our kids who have learning disabilities, if they're a year or two behind in their school and learning and school academic skills, then a lot of times they're a year or two behind in their behavioral maturity and their emotional maturity and how they respond and react to different situations. Do they have underlying anxiety? I think that's a big problem. If you are worried about stuff all the time and you have intrusive thoughts in your head all the time, it's hard to focus and concentrate when you have a lot of anxiety. What else is going at home and things like that. And so addressing learning disabilities, do they extra practice, more reading, less video games, less screen time, more help, more repetition. Maybe they need a 504, an IEP. When they're waiting in a doctor's office or when you go out waiting, shopping in a restaurant, maybe to carry a book and increase that reading and less gravitating toward that cell phone. Good sleep habits. The stimulant medicines, a lot of times people try, I don't necessarily jump to that because they can worsen anxiety. A lot of times I see a lot of failures. They don't work because of all the issues that we talked about, like the anxiety, like the learning disability, like the immaturity. There are these other medicines like the clonidine, the Intuniv, the guanfacine that can decrease hyperactivity, but can make inattention worse. So that's not always the solution. There are other medicines out there, Strattera, atypical antipsychotics that people use. And so I don't think that medicines, sometimes they're helpful in some situations, but not always. So, in the end, to summarize, I did want to hopefully you guys understand that a lot of our children with neurofibromatosis have learning and developmental problems, and developmental delays are a sign of future learning issues. there may be other underlying factors contributing to learning and behavior problems. And so we sometimes need to address those problems in other ways besides medications, and there may not always be an easy medication solution to these problems. All right, so thank you very much. Hopefully that was helpful to you. Now, to piggyback onto the things that I just said,